recent article in the Chicago Tribune has shown just how dangerous it can be to visit a pharmacy. Essentially, what we have here is a deadly combination of medications being prescribed, and the pharmacist doing absolutely nothing about it. We'll just get right to the details here. The Chicago Tribune, they published a story in December of 2016, and they sent people posing as patients into 255 different pharmacies with prescriptions for drug combinations with serious interactions, some potentially fatal. The result was an embarrassment to the profession. That's to put it lightly. 52% of the time, patients got the prescriptions without a word of warning or a phone call to the prescriber to double check that the prescriptions were okay. The best chain, this happened to be Walgreens, but even them, they were missing about 1 in 3 of these potentially dangerous and fatal drug interactions. And some of them were as high as 70% or greater. So this article here in the Drug Topics, February 10th, goes on to discuss that one of the chain executives, I don't know if it was CVS or one of the others, said that they were going to improve policies and its computer system to dramatically increase warnings to patients. Now, it's not quite clear what this actually means. Again, I doubt that they're actually going to do anything, but it's hard to know what this even means. Obviously, the computers don't warn the patients, so does this mean they're going to give the pharmacist more information? These potentially serious interactions already show up in all of the modern software programs. So I'm not sure you can really blame the software for what's going on here. So the author goes on, and some others have commented too, that the pharmacy chains have all kinds of data that they collect. How long people wait on hold. They do these surveys, obviously the number of prescriptions filled. It's pretty clear that they care about customer service when it's going to make them $1. When it's not, they just don't care. It's really just quite that simple. So the author of this piece here says his reaction was to call his software vendor, he's a pharmacy owner, to see how he could actually have fewer interactions appear on the screen. That way he would see only the most serious ones. Well, again, if the problem really is the software, then maybe something like this will help. Unfortunately, the problem is probably that the pharmacist was under so much pressure to get all these prescriptions filled, do all the flu shots, sell all the Christmas cards and greeting cards, and all the rest of it that goes on back in the pharmacy, that they just didn't do anything. When they get these warnings, there's usually an override key that you press, and if you were to spend even just a little bit of time in the pharmacy, what you'd see is them just hitting that override key just constantly, because they know they're going to end up filling the prescription anyway. So just run it through. If you're lucky, you might make a note on the bag to talk to the patient when the patient comes. Hey, did the doctor mention anything about this to you? That might get done by one of the cashiers. But certainly it's an extremely dangerous situation. There's every reason to believe that this is going on all over the place. Now, the study was done in Chicago, but why would we think that only Chicago is having 50% of these prescriptions going out of the pharmacy with potentially fatal drug interactions and not even a word being said? Clearly, it's being done in Ohio and everywhere else for that matter. What is the Ohio State Board of Pharmacy doing about this? What are they going to do about this? Obviously, time will tell. This was a recent, fairly recent article. My guess is that it'll be on the radar screen for 4 weeks, 6 weeks, something like that. These companies will come up with a plan. They'll send out a few emails, have the district manager go around and talk to people. And this time next year, you could do this exact study again, and you would get exactly the same results. Bottom line, no one is taking care of these patients. The chains really don't want that because it takes a lot of time and they're not getting paid for it. It's better to have the pharmacist counting pills, putting labels on bottles, checking prescriptions and things like that. Calling doctors, you don't get paid for that. Talking to patients, you don't get paid for that. You get paid for putting pills in bottles and getting flu shots. So this is what the pharmacist is spending their time doing, and these are the results. You see the reference at the bottom here, the Chicago Tribune, December 15, 2016. Check it out. Let me know your thoughts. Click to subscribe, and please provide any comments that you care to provide. Thank you.